Good morning. This video is for my viewers who are going to appear in the PAT 2 exam and planning to go to the UK soon, and especially for those who are planning their clinical attachment, because in this video I'm going to talk about my clinical attachment experience. Clinical attachment is for the ones who want to practice medicine in the UK. It helps international medical graduates like me to gain exposure in the NHS. In my case, it not only helped me polish my clinical skills but also my communication skills and helped me rediscover my interest in medicine. I did my clinical attachment in the city Lancaster, which was on 1 hour drive from Manchester, and the hospital name was Royal Lancaster Infirmary. My clinical attachment lasted for 6 weeks. I did in 3 different departments under 3 different NHS consultants. I spent 2 weeks in ENT department, which is ear, nose and throat, and 2 weeks in the emergency department and 2 weeks in the surgery department. All of my experience in each of these departments was great. The environment was very encouraging, very helpful and very supportive, unlike back homes. During my attachment, I had an opportunity to observe various professionals who were working in the NHS, from junior doctors to consultants. So the hierarchy in the NHS goes like this: that first you have to complete 2 years of foundation training, that is F1 and F2. And after completing your foundation training, you have to choose a speciality, and then you go into the core training or the specialist training and pursue your speciality in that. And after completing your specialist training, then you become a registrar, which is a middle grade doctor. And finally, after years of training, you become a consultant. So I started my clinical attachment with the ENT department. On the very first day, my consultant sat down with me. I remember she was having the coffee and she was in the theatre, and she asked me what I expect from the clinical attachment and what I want to do, what are the opportunities available, which I really appreciate. We just jot down the plan for my clinical attachment, mentioning what clinics I can attend, whether I can participate in the ward round as well, or whether there are surgeries lined up which I can observe. So why am I telling you, and why is it important for you to know? Number one, so you know that the consultants in the NHS are very approachable and they're very much interested in teaching. Number two, you understand that the clinical attachments are not passive. You must have your goals and questions in your mind, and you must not be afraid to share them with your supervisor. And number three, now you know what to expect on your first day. During my rotation in the ENT department, I had an opportunity to observe various procedures. In the theatre, I observed procedures like septoplasty, like the removal of the foreign body from the ear. Moreover, in the clinics, I had an opportunity to observe dedicated ENT clinics like those for the pediatrics and for the cancers. One day I spent in the audiology department, in where I learned about the hearing assessment and the balance disorders. I also had an opportunity to observe the one-stop neck clinic, which was dedicated for the head and neck cancers, in which the assessment and investigation of the neck lump is done in one day. I also observed various abdominal procedures during my rotation in the general surgery. Being present in the general surgery ward, I worked with the foundation doctors and understand what their actual job is. So most of the foundation doctors are involved in maintaining the patient charts, coordinating the discharges and taking history of the patients. So working in the ward, working in the clinics and the theatre, it all helped me understand the journey of the patient from the diagnosis to the actual surgery day. Emergency department was very fast-paced and an eye-opener for me. I had an opportunity to observe various acute cases in the resus area, and there were a lot of learning opportunities in the emergency department, ranging from attending the academic teaching sessions and participating in the quality improvement projects if you wish to. It was a really great experience in the emergency department. Particularly, I felt very much involved and very much supported in this department. This clinical attachment experience not only just helped me understand the clinic workflow of the NHS system, but also helps me, motivate me, and give me the clarity to understand the medicine. I would highly recommend clinical attachment to anyone who wishes to practice medicine in the UK. Please drop your queries in the comment box below, and don't forget to subscribe and share this video with your friends. Thank you.